Welcome to my channel, Health for Dance. I'm so glad you're here. I'm a dance scientist with a PhD in dance science, and I have many years of experience in full-time dance training. Today we're diving into something every pre-professional dancer should understand: the 5 identified risk factors for dance injuries. Whether you're a professional dancer, a teacher, a dance science student, a parent, or just passionate about dance, this video is for you. You'll gain insight into how injuries happen, how they affect your training, and most importantly, how to prevent and respond to them with confidence. Before commencing, I would like to emphasize that everything I share today is based on peer-reviewed research. All references are listed at the end, so you can trust the science behind it. Did you know that over 90% of dancers experience a dance-related injury? Their injury incidence is around 5 injuries per 1,000 dance hours, even higher than in other sports, such as gymnasts, footballers, and ice skaters, ranging from 1.4 to 4.5 injuries per 1,000 hours. That's right, dancers get injured more often than other athletes. Now, you may wonder what caused that. Let's talk about the 5 risk factors for dance injuries backed by a highly cited systematic review. Great, let's start with the first risk factor: previous injuries. If you've been dancing for a few years, chances are you've had an injury, maybe more than once. Studies identified that having a past injury significantly increases the risk of future injuries, such as lower back pain, lower extremity injuries, and lateral ankle sprains, either at the same site or on the contralateral side. But why? The reason could be incomplete rehabilitation. Typically, we follow a process from injury prevention, injured, treatment, rehabilitation, and return to dance. However, between rehabilitation and dance, some dancers did not return to training before they had fully recovered. That's creating hidden risks for re-injury. That's why it's critical to complete your rehab and listen to your body before returning to full training. If you feel pain or get any injuries, even if they are minor, they all deserve attention. Don't underestimate injury. Seek medical guidance and enhance your preventive awareness. The second risk factor is anthropometrics. Specifically, low body mass index, we usually call it BMI, and low body fat percentage. Many dancers strive for a lean appearance, often through restrictive diets. I remember back in my student days, we had to weigh ourselves before class. If the number went up, our teacher would warn us and ask us to eat less. That's stressful. But if your BMI drops below 19 or body fat is too low, the recovery process from injury gets longer. Why? Because a restricted diet limits energy, protein, and essential nutrients, all of which are vital for healing. Otherwise, it could result in a relative energy deficiency, which could lead to other injuries. If you're working on weight or fat loss, do it carefully. Health comes first. The third factor is low aerobic fitness, particularly among females. If you are interested, you can test your aerobic fitness with a heart rate monitor or digital watch ViDST. A higher heart rate usually means lower fitness. We all recognise that dancers with a strong level of aerobic fitness can perform well and minimise their injury risks. However, dancers with low aerobic fitness tend to become fatigued more quickly, especially during high-intensity exercises. This fatigue leads to poor alignment, ineffective biomechanics, and increased joint stress, which can trigger injuries. Thus, consider adding strength and conditioning training to your routine because it helps enhance the physical qualities and reduce injury risk. Next up, the fourth one: anterior pelvic tilt. A slight tilt is normal, no more than 8 degrees, but in dancers it can exceed 30 degrees, especially when attempting to improve turnout. Excessive tilt has been linked to increased lumbosacral pain intensity scores and decompensation in the pelvis, hips, knees, ankles, and feet. Teachers should help dancers correct faulty alignment and avoid artificial turnout. Supplemental training is recommended to strengthen the relevant muscles and support correct techniques. Finally, let's talk about the last one, inappropriate jump landing technique. Previous studies found that healthy dancers exhibited 4.37 times their body weight in peak vertical ground reaction force in landings. But dancers with knee injuries, like patellar tendinopathy, experience significantly higher ground reaction forces, up to 5.95 times their body weight. Why? Because dancers with patellar tendinopathy may adopt a landing strategy which makes them avoid bending their knees. As you can see, they performed in larger degrees than the healthy dancer to the right, resulting in stiff landings that can't absorb ground reaction force well. A small tip is to listen to the sound of your landing. Loud sounds indicate a poor landing technique. Previous studies encouraged dancers to perform soft landings by increasing knee and hip flexion. It's safer for your joints and prevents lower extremity injuries. In the end, let's review the 5 key risk factors and key takeaway points. 1. Previous injuries are associated with new injuries, both on the same side and the opposite side of the body. This could result from incomplete rehabilitation before returning to dance. Dancers should keep dance injuries in perspective and make sure they've fully recovered physically and functionally before returning to training. 2. A BMI below 19 and low body fat are associated with a longer duration of injuries. This is likely due to limited energy and nutrient intake, which slows down the healing process. Dancers should be careful when following restricted diets, especially during injury recovery. Your body needs adequate fuel to heal. 3. Dancers with poor aerobic fitness capacity tend to fatigue faster during intense routines, which can lead to poor alignment, compensatory movements, and biomechanical stress. Strength and conditioning training is an effective way to build aerobic capacity and reduce these risks. 4. An excessive anterior pelvic tilt, especially beyond 30 degrees, is associated with higher scores of lumbosacral pain. Since dancers often tilt their pelvises to enhance turnout, teachers should address this through technical corrections and provide supplemental training to strengthen the relevant muscles. 5. Dancers with patellar tendinopathy exhibit higher ground reaction forces in landings, often due to a stiff landing strategy that limits knee flexion. A soft landing, with more knee and hip flexion, improves shock absorption and helps prevent lower limb injuries. Great! Now you know how to protect your body and train smarter. I hope you've learnt something from this video and can apply it to your dance. All research cited in this video is listed below. Feel free to check them out. Thank you for watching. I'd love to hear your thoughts or questions in the comments. Feel free to suggest topics you're interested in, and I will do my best to prepare them when possible. Don't forget to subscribe for more science-based content. See you in my next video.